Dr. Dan Baruch, the director of Beth Israel's Center for Virology and Vaccines. Thank you. Joining us now is Dr. Dan Baruch, the director of Beth Israel's Center for Virology and Vaccine Research, who led design efforts for the vaccine alongside Johnson & Johnson. Thank you so much for being with us this morning, Doctor.
Thank you, Eva. Pleasure to be here.
Well, first, let's start with the question I think a lot of us are wondering. Do you anticipate that this emergency use authorization that Johnson & Johnson has now filed will be granted?
Well, as you know, J&J applied for emergency use authorization last week, and the FDA will independently review all the data and reach its own decision. But we are very happy with the data set. We think it's a very large and strong data set, so we are optimistic. If the FDA does grant emergency use authorization, then this will be the third vaccine to be rolled out in the United States.
Now, you were involved in the development of this vaccine. How confident are you in its ability to protect people from these new variants that we're seeing?
Well, that's an incredibly important question because over the last several months, we've seen the emergence of viral variants, some of which are more contagious than the original one, and some of which are actually resistant or partially resistant to antibodies. So we were very pleased in our study that showed that although there was a slight decrease in overall efficacy, the efficacy against severe COVID disease was 85%. And that was actually seen across the different geographic regions in the United States, in Latin America, and in South Africa. In Brazil, over 70% of the viruses were a circulating resistant variant. And in South Africa, over 95% of the viruses were a circulating resistant variant. So we can be very confident that this vaccine, even as a single shot vaccine, provides a very strong protection against severe COVID disease. And there were no hospitalizations or deaths in the vaccine group after day 28.
When you say those numbers, a lot of people start to think about the numbers that the other vaccines have released and that the numbers you just gave are actually lower than some of those other vaccines. What do you say to those people who are concerned that this vaccine may not protect them as much as, say, Pfizer or Moderna?
Well, the pandemic today is a much more complex pandemic than it was several months ago. So the trials conducted now are really a very different ballgame than trials conducted last fall. Last fall, there were really no concerns of these emerging variants that are more contagious or even resistant to antibodies. So our study was conducted during the peak global surge in multiple regions of the world. Our study was conducted in the setting of these variants that will likely reduce the efficacy of any of the vaccines.
And Dr. Baruch, thank you so much for being with us this morning. We appreciate you.